Hi, I'm Dr. Jeffrey Riopelle. I'm a cosmetic surgeon in San Ramon, and today's topic is on liposuction. Let's talk a little bit about excess fat. Many people have little pockets of excess fat somewhere on the body. Why is that? Well, even with diet and exercise, once we reach a certain age and we've developed fat in an area, some areas can be very resistant to losing that fat. And that's where liposuction comes in. For years, liposuction has been a technique that can be performed, but it used to have to be performed in an operating room under general anesthesia with all of the risks of the hospital and so on. What's great about liposuction today with all the modern technology is that it can be performed safely and comfortably right in the office using local anesthetic. So you can walk in, you can have the procedure, walk out a couple hours later, and you're fine. So let's talk a little bit about why someone would need liposuction. Who's an ideal candidate? Well, anyone with excess fat in a given area is an ideal candidate for liposuction. We, as I said, have pockets of fat here and there. So let's take, for example, a 45-year-old patient who I saw last week who came in with a little excess fat in the belly and on the sides and in the flanks. And she'd been exercising and doing the right things to lose weight for years, but for some reason that fat just wasn't coming off. It was resistant. So what we have available for her is called Smart Lipo or Smart Lipo Ultra. This is the Smart Lipo cannula, or rather a Smart Lipo laser fiber. And as you can see, it's very fine. It's less than 1 millimeter in size. So what we do with Smart Lipo is we numb the skin up, we make a little tiny nick in the skin in several places, and we slide the fiber in, and we can actually melt the fat. So it's almost like taking fat and taking butter and turning it into liquid. I actually tried that once with the cannula, and you can melt a cube of butter and turn it into liquid just with this little cannula. Heat comes out of the tip. So we melt the fat, and then very easily it can be suctioned out, just as easily as liquid butter can be suctioned. We also have Vaser. Vaser is ultrasonic technology, and in that case we actually do ultrasound on the fat to melt the fat. But either way, we're melting fat and we're removing it very easily through suction. So as I say, an ideal candidate is someone with excess fat in an area. And what areas can we treat? Well, we can treat the belly, the sides, the arms, the legs, the inner thighs, outer thighs. The chin is a great place. And what's also great about the new technology is we can tighten the skin. Before, people would often need maybe a tummy tuck because the skin on the belly was loose. Well, now we can take that skin, and after we've removed the fat, we can put the laser back in, laser right underneath the skin, and tighten the skin, because as we heat the skin, it contracts and it causes the collagen to grow over time. And that creates tightening. So those are the types of things that we can do with the liposuction procedure with the new technology that's available. And people can actually go back to work in a couple days now. There still might be a little bit of soreness, but nothing compared to what was experienced with liposuction before. So really great technology, and we'd love to talk to you further about it. If you want to give us a call, come on in to see us in our office. Oh, and by the way, what about regrowth of the fat in an area? Does the fat come back? Well, one of the really great things about when you've removed fat cells is those cells are gone, and our body only has so many in a given area. So suppose we've slimmed down the belly, we've taken fat out of that area, and that fat's gone. You gain weight. Well, where does the weight go? It's probably not going to go to the belly because there are less fat cells there. There's less ability to gain weight than there was before. You'll still gain some weight in the cells that are there, but because there are less, you're much less likely to see it. So it's fairly permanent in a given area, presuming you don't gain lots and lots of weight. Again, we'd love to see you in our office. We'd love to talk to you more about this. We have more videos below if you'd like to click on those. And thank you very much for listening to us.